So the Wellbeing Pledge is a set of ambitions and asks not only of organisations working within South Ayrshire, but also the population. So there's the two components. What can we do as organisations, but then also what can individuals do to support themselves? And that's looking at a range of different topics, such as how do we improve outcomes for children and families, but then also how do we support ageing well, and how do we make sure our services are designed and delivered in the best way that they can be. So, as a member of the Public Health Department for NHS Ayrshire and Arran, we really have a core focus and purpose looking at wellbeing as part of our portfolio. So how can we improve the health of our population? How can we reduce the inequalities in health and wellbeing at our population? And that covers from across the life course, from birth right through to older age groups. So it's a really central purpose and ambition for our organisation and department. So I think in terms of working with partners and communities, really the core focus is on relationships. How can we foster and develop these open, honest lines of communication, partnerships and conversations so that we can really work together to achieve the ambitions of the Wellbeing Pledge. So I think the Wellbeing Pledge actually really nicely outlines the priority areas. So I think it's looking at our population across their life course, so starting from our youngest members of society, children and young people, how can we look after them, how can we give them the best footing in life to grow up into healthy adults, but then also how can we look after everyone else in our population, how can we support those in the older age groups to age well and to live to their fullest potential into older age groups. So I think the Wellbeing Pledge outlines the priorities very nicely. So I think we need to be brave in what we do. We need to be able to look critically at how we do things and why we do things, and be open to change. And change can be a scary concept sometimes, but so I think as organisations, as communities, we need to be brave and we need to be committed to achieving the ambitions that have been outlined. So I would say that relationships matter. That interpersonal relationship matters. So the relationships that are in our communities between members of the population, relationships between the population and our services, and then up through our organisation right to the highest level. Relationships matter.